Cervical cancer is the most common cancer in women in India. Did you know that it can be successfully treated if detected at an early stage? Hi, I'm Dr. Lakshmi, and you're watching Yashoda Hospital's The Health Talk session, where all your health-related queries are answered here. So let's discuss and know more about cervical cancer and, more importantly, its preventive methods. Joining our discussion today is Dr. M. Suneetha, Senior Consultant Radiation Oncologist and Clinical Director from Yashoda Hospital's High-Tech City. Welcome to the program, ma'am.
Hi.
So in spite of global falling trends of cervical cancer, it is still a major healthcare challenge, especially what we are seeing in our country. So to begin with, what exactly is cervical cancer and what is the burden of this cancer in our country, doctor?
Cervical cancer is the second most common cancer among our Indian women, and the first most common will be the breast cancer. So what is cervical cancer? This is a cancerous growth which happens at the cervix, which is in the lowermost part of the uterus. So the uterus is a conical pear-shaped structure, and in this you have the lowermost part of the uterus, that will be the cervix. So this is a cancer which happens in the cervix, and normal risk factors like it's usually a cancer which happens because of a virus infection. So HPV virus is the most common virus which is associated with this infection, with this cancer. And 80 to 90% of the times cervical cancer is related to HPV virus infection. So how does this cause cancer is something which we need to understand. Whenever the mucosa is intact, will not have any problem. But when the mucosa starts having some minute aberrations or something like that, in that position what happens is the virus will have a access into the cervix. So as long as the patient's body immunity is good and there are no other risk factors like alcohol or smoking, in those cases all this virus, even if it enters into the body, it will be killed by the human body immunity system. But once the virus cells gets an access into the cervix, then they continuously rapidly multiply, and then that will cause the cancerous mass in the cervix.
So this being the second most common, especially in our country. So is there any particular age group which are affected more? And what are the symptoms that one should look out for, doctor?
Normally, like 20-25 years back, we used to see these patients at a very elderly age, around 60 years, 70 years. That was the most common age group what we used to see in the previous years. But now, recently, what we have seen is like the patients are presenting even at an younger age, like 30s and 40s also. So the most common first symptom for these patients will be a postcoital vaginal bleeding. That is, immediately after the sexual intercourse, these patients will have a minute bleeding. That is the first symptom. So as days prolong and as the stage of the disease progresses, these patients will have a continuous bleeding per vaginum. And then other common symptoms will be the white discharge per vaginum. And then the late symptoms will be like back pain and cough, or sometimes even jaundice also can happen in a very late stage if at all the disease spreads to the liver. But normally bleeding per vaginum and white discharge, these are the two most common symptoms for cervical cancer.
So what are some potential risk factors which are associated with this cancer, doctor?
So as I told you, HPV virus is the most common virus which is associated with this cancer. The next other risk factors would be the tobacco chewing, then this cigarette smoking, alcohol, multiple pregnancies, because I'm a sexually active female. So what happens is, in these women, there will be chances of repeated aberrations to the cervix, and the virus can have a easy access into the body.
So as with any cancer, early detection is the key. So could you emphasize on the importance of screening tests for cervical cancer, doctor?
Yes. Fortunately, cervical cancer is the cancer where you have a high latency period. Means that once the body, the virus enters into the body, it takes almost all 15 to 20 years for this virus to develop into the cancer and also produce the symptoms. So we have such a long time with us. So it is always preferential, and it is always better to get a regular screening tests like pap smear or HPV virus detection test. These are the tests which will help us in early detection of the cancer. So if you see the guidelines, it is recommended that after 21 years of age, it is required for us to get a regular pap smear at every 2 to 3 years interval. But see, for our busy schedules and all, we often tend to forget these things and we never get it done. In fact, being an oncologist, we also don't go for such a regular screening test. So WHO has come up with a better alternative, okay, a safer alternative. If at all you are not at high risk for these problems, for this cervical cancer, in that case, what you can do is you can go for at least 5 years, every 5 years if you can go for it, maybe starting at 30 or 35 years of age. And then after that, second, maybe around 40 years of age, and then after 45 years of age. So every 5 years is also a safer alternative if you are not going for a regular. But you have to do it. Otherwise, there is no way that you can identify this disease as early as possible.
So cervical cancer is completely curable cancer if detected at an early stage. So once diagnosed, doctor, what are the various treatment options which are available for the patient?
Suppose you are coming at a stage 1 disease. What is stage 1? Where the disease is limited only to the cervix. In these cases, in these stages, it is like only surgery should be more than enough for these patients if you are doing at a very early stage. Suppose there is always a chance that because we are seeing these young women where even in 20s and 30s also we are seeing these patients. In those cases, you can even go for a trachelectomy. Trachelectomy is a kind of surgery where the cervix, uterus, everything will be preserved and only part of the cervix will be. So the reason for doing these minimally invasive surgeries or minimally organ preserving surgeries is that we don't want the patient to lose the fertility. That is the kind of treatment what we offer when we see these patients at an early stage. But because of a lack of awareness or because of their family pressures or whatever it is, some patients, they come to us in stage 2, 3 and 4. So in these cases, it is very difficult for us to treat these patients with surgery. So what we do is we give chemotherapy and radiotherapy, which is the treatment of choice. So being a radiation oncologist, like I come across many patients who come with all multiple questions and fears in their mind, saying that is radiation safe? Does it feel like a shock treatment? Or and those kinds of fears are always there with the patient. So what I tell you is we have lot of recent advances in the field of radiation therapy or medical oncology or surgical oncology, all this. So as far as radiation is concerned, the radiation is not at all a pain. It's not a painful treatment. It's very safe. Patient will not even know that something is happening in their body, or it's not like that shock kind of treatment. All those machines are gone now. What we have is the high-end machines where, in fact, we do the daily adaptive therapy also. Here, what we have in our hospital is the MR-Linac. So, advantage of doing an adaptive therapy is because the organs keep on moving within the body. In those conditions, it is always preferable to do a adaptive kind of treatment where we contour all the structures, okay? We try to map all these normal structures and try to plan our radiation in such a way that the tumor will get maximum tumor dose and maximum coverage with the radiation and at the same time avoiding radiation to the normal structures. This is the kind of advanced treatment what we do. And MR-Linac is comparatively safer than a CT-based adaptive therapy. So it is a conformal treatment what we are able to achieve with these recent advances.
So adaptive therapy is the latest technology where the radiation is delivered to the tumor, avoiding the normal surrounding tissues and resulting in less toxicity. So talking about fears, doctor, I'm sure there are a lot of myths surrounding cervical cancer. So would you like to clear a few of them?
After first two fractions, they will get adjusted to the radiation. They will have whatever that fear is there, that it's a kind of electric shock or whatever kind of problem which is going to happen to them. Like, they'll be happy after first 2 days. But there is always a fear for them that the brachytherapy, because cervical cancer, we have to combine both external radiation and also internal radiation. Internal radiation is like where we have to insert the radioactive sources within the cervix itself, directly into the cervix. So there's always a fear that this is going to be a very painful thing, and it has been painful. There's nothing, that we have to hide from the patients. It was painful in the previous days. But now what we do is, for the brachytherapy, we treat these patients directly under anesthesia. After external radiation, the major part of treatment for cervical cancer is brachytherapy. 50% of the cure will happen with external radiation, but 50% of the treatment will depend on doing a good brachytherapy. It's not a painful treatment, and also it is like it will reduce lot of side effects to the normal structures also, because you are doing with MR brachytherapy there. Okay, so that is also one recent advance. I think patients should be aware of it, and please ask for those kinds of recent advances if it is possible for you.
So before we wrap this episode, doctor, what message you would like to share with our audience out there on cervical cancer?
Prevention is always better than cure. Go for regular pap smears. This will prevent you from happening of this cervical cancer in your body. And then the next thing is, even if cancer is there within your body, it can be curable if you are getting a proper treatment. Do not get panicked by this cancer. We have all the kind of recent advances which can help you in reducing this burden on you and your family also.
So thank you, Dr. Suneetha, for an insightful discussion on cervical cancer.
Thank you.
So this brings us to the end of this episode. Remember, cervical cancer is a completely curable cancer if detected at an early stage. Stay informed and join us for next week as well for more insightful discussions. Until then, take care and stay healthy. Thank you.